A very good afternoon and warm welcome to all our viewers. On behalf of Human Biological Institute and Fairless Against Rabies, Fairless Against Rabies is an initiative by Human Biological Institute to educate about rabies and to reduce the incidence of disease. It's my pleasure to take this opportunity and share about Human Biological Institute. Human Biologicals Institute, a division of Indian Immunological Limited, shaping global healthcare by spearheading the One Health initiative. Indian Immunological Limited was established by National Dairy Development Board (NDDB) in 1982 as its unit, and later registered as a company in 1999 with the name Indian Immunological Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunological Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. This facility is one of its kind in India to have rolled out first virocell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines, and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and in present in around 60 countries. We are three state-of-the-art manufacturing facility at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. Our values, we believe in providing affordable product with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are the kind of company who will definitely look after taking care of the environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand Abhairab, and with this we have taken significant step to reduce the plastic burden by 160 ton per annum. Coming to a corporate social responsibility, as a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is adoption of government school. Indian Immunological Limited has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Milk Program in coordination with National Dairy Development Board. Over 1,600 school-going children of Telangana and Tamil Nadu are benefited. We have also facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. Well, you can visit us on our website www.indieimmune.com and can also call us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. You can visit us on our website www.fearlessagainstrabies.com, which is our unique initiative on fight against rabies, and everything you want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today on Fearless Against Rabies platform. Well, in today's session, we are going to learn about a very interesting topic, which is myth and facts on rabies. Well, rabies, being a highly feared and misunderstood disease, is unfortunately surrounded by numerous myths and a misconception. These misconceptions often lead to unnecessary fear and misinformation among the public. It's very crucial to address and debunk these myths to ensure accurate knowledge. To enlighten us about this topic, we have a very special guest with us today. Please welcome Dr. Jyoti B. Datta. Dr. Jyoti B. Datta, a renowned professor and head of the Department of Veterinary Epidemiology and Preventive Medicine at the College of Veterinary Science, Assam Agriculture University. With expertise in infectious disease of animals, biosecurity, and research on animal disease epidemiology, including rabies. With her impressive credentials, dedication, and profound expertise, Dr. Jyoti B. Datta stands as a beacon in the field of veterinary epidemiology. Her unwavering commitment to teaching and research undoubtedly made a significant impact on veterinary science, inspiring future generations of professionals to contribute to the betterment of animal health and prevention of infectious disease. A very warm welcome, Dr. Datta, on our Fairless Against Rabies platform.
Thank you for having me.
Thank you, Doctor. Doctor, while we start for our discussion for today, I would request you to kindly explain our viewers that, directly coming to the question is what is the incubation period for rabies after a person is bitten by an animal?
Well, the incubation period for rabies after getting a bite by an individual is variable. And it depends mainly on two factors, that the animal bite containing the infectious saliva deposited at the bite site, what is the viral load or viral concentration, and what is the virulence of the virus. So these two factors are very important. And second factor is the host. So the host, what is the age of the host, and the immunocompromised status or immunity status of the host also is very important. And third point is how many bites, or what is the site, what is the distance from the bite site to the central nervous system, that is the brain. So all these three factors are very important and needs to be considered in determining the rabies incubation period, which is very variable, and it can vary as short as within a week. An individual after getting a bite can get the clinical signs, or it can prolong to few months or even years. So many years can also be elapsing before the clinical signs are manifested.
So, doctor, as you mentioned about the incubation period as well as the clinical signs, so what could be the process for confirming that a person has contracted rabies or animal has contracted rabies?
Yes, that is very important. Actually, when the clinical signs appear in an individual human being, particularly, the patient himself can give the history that he was bitten or he had the exposure to any animal bite or lick. So the clinical signs needs to be corroborated with the the findings, like if the laboratory findings of his sample, saliva sample or nape biopsy needs to be confirmed. But in case of animals, it is difficult because mostly the animals get the bite from free roaming dogs, and the bite site is not visible to the owner or the handler.
Okay. So,
So the because it is covered by fur, or the hide is covered by the hair, so bite is not noticed. So most of the animal bites getting clinical signs of rabies is not noticed, that having the bitten by a dog.
okay. So, thank you, doctor, for answering that. So, doctor, when we talk about the re-exposure, So, what is there any protocol for managing the re-exposure of rabies, and does it even differ from the initial post-exposure prophylaxis treatment, as we say?
Re-exposure normally, if an individual having had an exposure, that is post-exposure prophylaxis, the 5 doses of the SN regimen or Thai Red Cross regimen of the intradermal or intramuscular vaccine completed. If within 6 months the individual gets another exposure, then he can go for safely, he can go for 3 doses of the WHO recommended doses post exposure once again. And normally, for the pre-exposure given to all those high-risk groups like veterinarians or animal handlers or forest workers, rangers, etc., they should go for the pre-exposure and annual booster dose every year for 3 consecutive years without break, and thereafter they should go for one single vaccination booster every 3 years. So 0, 7, and 21 or 28th day is the pre-exposure. Thereafter, annual single dose for 3 years, and thereafter, every 3 years, one dose is sufficient. So that will maintain the protective antibody titer. Immunity will be provided to the individual.
Uh, Thank you, doctor, for answering this question. Giving the audience, telling the audience about the incubation period as well as the clinical symptoms and the protocol for managing the exposure. Doctor, I want to ask you that what is the most crucial information about the rabies disease that the general public should be aware of?
Well, that is a very important question, and that is a very important issue for the general public, that they should always be aware of animal bites or any exposure with animals on their cut wounds or skin having the exposure with animals. They should always consult a doctor after thoroughly washing the wound, consult a doctor and get the post exposure prophylaxis. Instead of going to the village medicine or traditional healers, having all those unproven efficacy of those remedies, we should always promote the vaccine, which is very effective and it is also safe for all individuals irrespective of age. So that needs to be promoted and highlighted in the society.
Thank you so much, doctor, for giving the most crucial information about the rabies. Doctor, it's time that we take some questions from the audience. So, the first question that we have received is the person is asking, are there any potential side effects or risk associated with vaccines for animal exposure?
The vaccines developed against rabies, that is anti-rabies vaccine, has undergone a lot of testing, and these are found to be highly immunogenic, that is highly protective against rabies virus, but at the same safe. So individual need not have any of any side effect, any adverse reactions from the vaccine, because these are cell culture vaccine and it is very safe.
Thank you, doctor. So, there's another question asking that are there any age restrictions or specific consideration for vaccinating children against animal exposure?
For young children, all the children are highly vulnerable to rabies because of their exposure in the outdoor while going to the school, and laboratory testing of the vaccine on the children has not shown any adverse effect. So it is equally safe for children, all
Thank
age
you,
groups.
doctor. Uh, Thank you, doctor, for answering this. There's another person asking, can pregnant women receive the rabies vaccine for protection against animal exposure?
Yes, pregnant women also have been found to have received vaccine and have delivered the baby without any complication, and the babies are safe after having the mother being vaccinated. So there is no issue regarding pregnancy, and it is very safe for pregnant mothers as well.
Thank you, doctor. There's another question with the same. So this question is: if a pregnant woman receives the rabies vaccine, are there any follow-up measures or additional vaccination required after childbirth?
Not necessary. When the pregnant lady receives the vaccine post exposure, that is 0, 3, 7, 14, and 28th day, Thai Red Cross, or the intradermal dose, that is on the 0, 3, 7, and the 28th day dose, there is no requirement of additional vaccine.
Okay. Thank you so much, Doctor, for answering this question. There's one question by Mr. Amit Pramanik. He's asking, suppose someone is taking anti-rabies vaccine and after three vaccination, the person got another bite. And then after, what should be the
Hmm.
dosing schedule?
Because the individual is already in the schedule of receiving, already the individual has received the 0 day, third day, the seventh day, and the vaccine has already stimulated the defense mechanism in the individual for antibodies. So there is no issue, there should not vaccine is required. He can continue, or she can go ahead with the 28th day vaccine.
So thank you so much, Doctor, for answering this question for Amit Pramanik. Well, Doctor, thank you so much for answering over all the audience questions. Thank you so much. Doctor was
I
a very
thank you.
well, Doctor was a very wonderful session that we had. Uh,
Thank you for
Doctor, we
giving me an
wholeheartedly
opportunity.
thank you, Doctor. We wholeheartedly thank you, Doctor, on behalf of my team as well as the Human Biological Institute for sparing your most valuable time with us. So thank you once again.
Thank you and welcome.
I wholeheartedly thank our viewers as well for being with us in each and every session. You can all follow us on LinkedIn, Facebook, Instagram, and Twitter to get more updates on live talk with expert doctors across the nation. With that, I wish everyone a very good afternoon. A very good afternoon, doctor.